Hi, everybody. Just to reintroduce myself, my name is Zara Patel. I work here as an associate professor in the Department of Otolaryngology at Stanford University School of Medicine. And I've been asked to update the institution about COVID demographics around the world, here in the US and in California, and specifically in our county here in Santa Clara and San Mateo counties. And I am going to share it with all of you as well, so that if you find it helpful, uh, you can also benefit. So overall, unfortunately, there is a new global rise in cases. We were seeing a nice downturn in the case rates, but now they're up again. And this is primarily due to Europe and somewhat Russia, but primarily Europe. Cases in the US and California were coming down, but have now plateaued. Unfortunately, they're not going all the way back down to where we saw the very low rates in the summertime. Hospitalizations, thankfully, are decreasing. Mortality is decreasing slowly, and we have a little bit of an uptick in vaccinations. So starting with vaccinations, you can see, unfortunately, the US continues to fall down this list of countries. We are still at the mid 50 range, but the good news is that now at the end of this last month, the end of October, at least one dose of the COVID vaccine has been given to over 50% of the world's population. So that is a landmark and a milestone to celebrate. You can see that here in the US, we are administering about 1.32 million average doses per day. And that is a little bit up since October, which is great news. And you can see that the states that continue to have very low vaccination rates, really West Virginia is the main holdout. Idaho and Wyoming and these other areas that I've starred have actually continued to improve vaccination rates slowly but surely. Over here in California, 73.6% of the entire population is fully vaccinated. And you can see the amount of doses in Santa Clara and San Mateo County here. And when we look at the vaccination rates per age group, you can see that in Santa Clara County, 85.5% of the age over 12 has been vaccinated, which is a great rate. When you look at the age group over 65, thankfully, we are doing pretty well in that age group also within our county, 83.1%, but that is still a little bit behind the US overall in that age group. And you can see that California overall is really lagging a bit in that age group. So we really need to do better and get the word out to our elderly colleagues and friends that this is an important thing to have done. When we get to global cases, here's where you can unfortunately see that rise in cases once again, 8% increase over the last 2 weeks. And you can see here in this map, the hotspots really focused on Central Europe there. And I've just selected a few countries to highlight here. Specifically, if you look at Belgium, you can really see that exponential increase. And this, is due to things like relaxation of mask mandates, a sort of opening up of socialization, while at the same time, case rates are going up. And unfortunately, the cases have really gotten to the point where the hospitals are starting to become overwhelmed. Even public service like the police force are not having their full staffing, and some police departments have had to close in that country. And some providers, doctors and nurses that are testing positive for COVID-19 are still being asked to come into work in spite of being positive, just because they are so short-staffed. And so they're really reaching a crisis there. We wish them the best and hope that they get through this well. Nationally, you can see that we were coming down well, but unfortunately, there's been a bit of a plateau in our case rates recently, and a 6% increase in the last 2 weeks. You can see the hotspots within the US sort of continue to be these northern states, the Mountain West, and specifically West Virginia, with the rest of the areas clearing slowly. In cases in California, you can again see this nice downturn turning into more of a plateau, a little bit of a spike recently and then down again, but plus 9% over the last 2 weeks. And in Santa Clara County, you can also see this little bit of a plateau recently in cases. San Mateo County also mirrors that, in that low chart in the middle of this graph. When you look at Stanford cases, you can see we're thankfully doing pretty well here still, just 10 cases in the last week, and overall a case positivity rate of just 0.08%, which is very good, especially compared to Santa Clara County, which 70 positivity rate is 1.3%, and overall California, which has a rate of 2.4%. So we're doing quite well here. And that holds true for our Stanford faculty, postdocs, and staff, where you can see 5 cases in the last week with an overall positivity rate of just 0.11%. When we look at the variants, you can see that really it's still all about Delta. That's the really only variant that is worth taking note of. When you look at this Delta plus variant, the AY.4.2 that I mentioned at the last report was postulated to be the reason for the surge in the UK, you can see overall our prevalence globally in the US and then here in California. And you can see that although there has been a little bit of an increase recently, if you look at these actual percentages, you can see in the US, it's less than 1% overall. And in California, just over 1% of the cases. And remember, this is included in the whole Delta variant case rate. So when we look at specifically Santa Clara County, it's really all about Delta. I've highlighted Mu and Lambda simply because the WHO variants, the WHO calls these variants of interest, although Santa Clara County is really just showing that they're being monitored because they're so low in their case numbers here. In pediatrics, finally, we have a little bit of a dip from this steadily increasing percent of all cases. In October, pediatrics made up about 25.5% of all cases, and now that's come down to 24%, still up from the approximately 15% that there was through most of the pandemic up till August of this year. You can see that hospitalizations and mortality remain nicely low. And thankfully, we now have this vaccine to administer to children 5 to 11 years of age. I've put this here just for people who have interest and show the dramatic difference that the vaccine had on the pediatric population that was included in the study, thousands of patients. And, really, this is a good testament to the safety of the vaccine, the low rate of adverse events, especially compared to the rate of events when someone actually gets COVID-19. When we look at hospitalizations, you can see that thankfully this continues to decrease over time. And in California, similarly, there has been a decrease, although if you look at the tail end of these graphs, you can see that there has been a bit of a plateau very recently. This is very likely because of what I mentioned before, this age group of 65 and plus. We simply do not have as high of a vaccination rate here in California than the rest of the country. And this shows by this sort of persistence in hospitalization rate. When we look at Santa Clara hospitalizations, similarly, it was decreasing and now a bit of a plateau. And similarly with San Mateo, there's a bit of a plateau again. Thankfully, in San Francisco proper, the case rate and hospitalization rates do continue to decrease. And overall in the Bay Area, there is a decrease, slow, but there. And then mortality, when we look nationally, you can see it was decreasing. However, there is a bit of a recent uptick. We'll have to just watch this. Hopefully it's just a bit of a jog up in the graph and it will continue to fall after that. When you look at California, you can see similarly, it was sort of plateaued for a while and now there is a slow decrease again, thankfully. And Santa Clara County, you can see that again, there is this slow decrease with 42 deaths over the last 2 weeks. And finally, just to point out the most important piece that all of you can take away from this, which is here in California, and this is mirrored in national and global case and death rates. According to vaccination status, you can see that unvaccinated people in California are 6.8 times more likely to just get a COVID-19 infection than people who are vaccinated. And unfortunately, 18.2 times more likely to actually die from COVID-19 than a vaccinated individual. So definitely share this information with all your family and friends, and I will stop sharing. And I hope that that was helpful for all of you, and stay safe and healthy. All my best.